We're coming in hot with inspiring guests, witty banter, and colorful commentary for today's veterans and military community. This is the Tango Alpha Lima podcast.
They call me crazy cause I'm facing all my giants. They try to scare me into thinking I can fight it. They tell me I should never even think of trying. But that's just me, I'm gonna live out in defiance.
Oh boy, welcome back to the Tango Alpha Lima experience. I've heard it's sweater weather, but I'm in Los Angeles where it's just sweaty weather as always. Ashley, how's the weather there?
Absolutely beautiful. I have opened all my windows and I'm that crazy person on the block who is like, it's time. It's my weather time. Yes.
Yeah. And that you think that's the characteristic of you that makes you crazy? I have a spreadsheet. Actually, I'll send it to you after the show.
I would really be interested in seeing that because I'd love to see the progression because I know you've been keeping tabs on me for years. Oh, yeah. It's like, I just want to see the level of crazy that I have ascended to.
And the fact that I've been keeping track of you doesn't indicate any crazy on my part.
No, not at all. You're just monitoring my mental health. I appreciate you, bud.
Oh, we had a rule. We're not calling me bud. Are you a So it is October Day. Are you a pumpkin person and pumpkin spice? And
no, so I will say the lengths of which I will go for the fall are going to a pumpkin farm. I've enjoyed the aesthetic. Something I did as a child growing up with my family in Ohio, where we would go to this place called. That. Yeah, I did. We used to go to this place called Badger Farms, and it was West Salem, Ohio. It was a tradition my grandparents started, and majority of my family still goes. It's just one of those things where we're wrestling pumpkins and detangling vines from our ankles, and drinking apple cider and having homemade pumpkin donuts. So that's really the fall, the essence that I look forward to.
So you don't.
I do enjoy decorating for Halloween though too.
You don't go to Starbucks and say, give me the pumpkin spice?
No, I don't drink coffee.
Okay.
I know it eludes all the alphas out there, but I do not drink coffee.
We have
run on pure meat all the time.
We have that in common, actually.
Yeah, I'm just not a coffee fan. And it's all sugar. No disrespect to all of my Starbucks and coffee fans out there. It's just a lot of sugar. And I don't like drinking my calories.
It doesn't have to be. You know that, right?
It doesn't have to be. I agree.
You can order just a cup of Joe.
Cup of Joe Black, right? Just grind to the earth.
All right. People now know our aversion to coffee. They know that it's sweater weather there and it's sweaty swamp behind weather here in California. I can say behind, right?
Yeah.
All right. I got approval from super producer to say behind. We're a family show. We sometimes forget.
Family.
All right. We got some cool news coming. Money.
I don't know about that. Let's slow your roll there. So there are major changes coming to the VA. So the VA is going to be overhauling its veteran disability evaluations for mental health. So here's more from military.com. So as the VA plans to update the schedule for rating disabilities, its guide for determining how it evaluates and provides benefits for service-connected disabilities, for example, mental health conditions, to include their impact on veterans' lives, and abolish the 0% disability rating for any service-connected mental health diagnosis in favor of a 10% minimum, according to the notice published Tuesday by the Federal Register. For tinnitus, the department will get rid of the standalone rating and consider the condition a symptom of whatever underlying disease it causes. As for sleep apnea, ratings will be assessed based on their effectiveness of treatment and the condition impact on earning impairment, according to the notice. The VA hopes that by changing how they assess conditions, they will be able to ensure veterans are compensated appropriately. So ultimately, once these changes go into effect, veterans with mental health conditions will likely see higher disability ratings, but fewer will likely be able to receive compensation for other conditions such as tinnitus or sleep apnea. Be advised. If you are a veteran and already receiving compensation for these conditions, the department said that you will not be seeing your rating downgraded when the change kicks in. It's very important. So it is widely known that the current VA disability rating system does a poor job compensating vets who lose earnings if they can't work due to service-related mental health conditions. So hopefully the VA's overhaul will vastly improve this issue. So veterans who think that their ratings should be upgraded based on the new criteria should file a claim with the VA as soon as the change takes effect.
So I think the word upgrade in that sentence is key, because I would say, not that I recommend gaming the system, but they are putting in place time and space rules, which imply that gaming is going to be beneficial. So get rated now. Go through a service officer. As we said before, don't try to do it on your own. As I said when we were talking earlier, if you are a professor of law at Harvard University School of Law, you still do not represent yourself in court. It's a very, very dumb move. As I would say, don't try to do the claims unless it's something you do every day, because you don't know the wording they're looking for. You don't know if you're filing all the proper paperwork. You don't know if you're gathering the evidence that they're looking for. It's not necessarily the most logical thing. It's what they're looking for. So you need somebody who does this every day. And I would say to do these things early and then go back to your VSO and say, should I refile now under the new changes? And I think I think part of this is, abolishing the 0% rating for a service-connected mental health diagnosis is long overdue. You're saying it's service-connected. It drives me crazy when I see 0% service-connected, because English words mean things. It's saying you are 0% service-connected, meaning you're not service-connected. So I'm in favor of all these things. I know you work there, so you can't say anything. So yeah, you can't say anything.
Well, what I
I actually
can
love
say,
that. I actually love that for you.
what I can say as a disclosure, I am a Service Connect disabled veteran, regardless of where I work, right? I can speak on behalf of my own experience. And I know what it's like to get that 0% back in a VA, claim letter. It's not fun. It's confusing, right? And as someone who is, 70% Service Connect disabled, I understand how frustrating it can be, which is why I would continue to encourage folks to get onto the American Legion website, use our service officer locator tool, and work with a service officer of your choosing through any of the large veteran service organizations, to include us, the American Legion, or whoever you're working with, whether it's Dave, VFW, AMVETS, whomever. Have that conversation. It can't hurt. Like, don't think, oh, well, I already know. Just ask the question. If you need to be reevaluated, you are just go through that process and be reevaluated. You have earned those benefits, right? Like, I've had the conversation before about entitlement versus eligibility. Like, if you already are Service Connect disabled and you have a 0% rating in any of these that we've mentioned, and or have an existing rating, you don't know what you don't know. Go and speak with a veteran service representative, have your claim reevaluated, see if you are able to, increase your disability. And obviously we discussed there will be no foreseeable downgrade for any of these things we discussed, but that's something you need to speak with, because we can't do a cookie cutter approach to this. You are your own individual through your service time, and you know yourself better. And I encourage people to go do it. I really do. I know my process alone, it took about 3 years with an appeal. It was a bit time consuming, but it was well worth it. And I will tell you what, I highly encourage veterans to go out there and do it. I'm always displeased when I hear vets say, oh, well, some other veteran out there is, needs it more than I. No, like, that's a part of your benefit. Go and get evaluated, apply for your Service Connect disability, if so, having Service Connect disability. So that's what I will say.
For someone who mentioned that she couldn't comment on anything,
You're welcome.
We got a lot of, why do you keep doing that? You're welcome. Is that the new DC thing? Whatever
Maybe.
you say, you end it with "you're welcome." We
I'm
got a lot of
doing
comment.
our alphas a favor. I'm giving them the,
You say
the
"good
down low.
morning" and then say "you're welcome," though. You say like,
Eh,
"Yeah,
I'm my own person.
you're
Sometimes
welcome,
you don't know
bud.
what you're gonna get.
You're welcome, bud."
Well, OHIO. Woo.
All
Yeah,
right,
I will say all the bingo words today.
let's. We are going. Oh, we have a guest today,
We do.
which is weird because that I sounded excited because we have a guest every time nowadays. Ever since season 2, have we had a guest every day, or
I
is
think
it just
so.
3? I think it's
I'm
just
loving
3.
it though. We get to talk to some amazing people,
What are you trying to say?
some
When you're just
amazing folks.
when you're just talking to me, that's
I mean,
rude.
I get to talk to you all the time.
Uh-huh.
I refer to you as my LA bestie. LA bestie. People are like, "Who's Jeff Daly?" I'm like, "Oh, he's my LA bestie.
Aw.
He's out there
Which means she
representing on the
hasn't met
West Coast."
anybody else. She hasn't met any other people in LA.
Womp
I'm just
womp womp.
all right. Today, we're going to be joined by Mission Roll Call Executive Cole Lyle. Cole is a U.S. Marine Corps veteran. Raw. His 6 years of service included deployments to Afghanistan. After the military, he worked on the mental health care programs at the American Legion National Headquarters in Washington, D.C., as an advisor to senior leadership at VA and on veteran policy in the U.S. Senate. We'll be back after a quick change of clothes, and we're going to talk about Mission Roll Call with Cole Lyle right after the break.
Veterans, did you know that hearing loss and tinnitus are the top service-connected disabilities, and that untreated hearing loss frequently results in social isolation and loneliness? Studies show that these issues, in turn, can lead to a host of other potential conditions. Staying connected with family and friends is so critical to our health as veterans. The Heroes with Hearing Loss program, provided by Hamilton CapTel, supports veterans who face the challenges of hearing loss by providing solutions to keep us connected. Solutions such as caption telephone allow veterans with hearing loss to listen and read what is said over the phone, making it easier than ever to connect with those who matter most in life. And now, veterans can self-certify their hearing loss to receive a Hamilton CapTel caption telephone and service at no cost. Learn more at heroeswithhearingloss.org. If you were stationed at Camp Lejeune between 1953 and 1987, you and your family may be victims of toxic water poisoning. Cancers, birth defects, deadly illnesses have all been linked to the contaminated water. With passage of the PACT Act, the government is ready to be held accountable. You could be awarded financial compensation for your suffering, but you must act now. Get your free case review. Call True Law at 833-686-4242. That's 833-686-4242, or visit justicecamplejeune.com/TAL.
All right, welcome back to the Tango Alpha Lima experience. As promised, we have another fellow Marine Corps veteran, hoorah, here today, Cole Lyle, who is also, he's a Legion member at Post 8, the Kenneth Nash Post 8 Hill, over there on Capitol Hill with our good friend Carol Lindemood Harlow. So shout out to her. But today it's about Cole. Cole, how you doing?
Doing great, Jeff. Thanks for having me on.
All right. I got that Kenneth Nash from a little research I did by asking you, so I hope you're credible. So, and know what post you belong to. So today we're going to talk about you and what you do. I don't get to start the questions because Ashley always gets to go first, I guess.
Okay.
Ashley.
All right. I will take it away. Take it away. All right. So the first question I'd like to ask is, what is Mission Roll Call and how did it get started?
Yeah, so Mission Roll Call is a national advocacy organization. We have over 1 million veterans that have opted into our text and email list. And the whole idea, right, is to ask questions on relevant things under consideration by either the VA or Congress or the White House, poll those veterans and provide that information to, if it's a national poll, committees of jurisdiction as they're deliberating on this stuff, But we can also get as granular as zip codes. So sometimes we'll take trips out to veteran heavy populations in the United States. We went to LA earlier this year, Dallas, Fort Worth, the Florida Panhandle, and we ask how veterans feel about their local VAs, and then we feed that information back to their representatives in Congress. So it gives them a great idea. As somebody who used to work on Capitol Hill and understands that staffers and members oftentimes deal in the abstract, we also try to highlight veteran service organizations and veterans in local areas so we can make that data and the experience that veterans are having in those areas stick with members of Congress. Our top 3 priorities per the veterans that we speak to are suicide prevention is number 1, access to care and benefits, number 2, and then amplifying the voices of underserved veteran populations, traditionally underserved veteran populations. So tribal veterans, veterans in rural areas, female veterans, that type of stuff. So those are 3 pretty broad things. So as you can imagine, we can get involved in a lot of different policy areas, but that is in a nutshell what we do.
Okay, that is a lot. I'm looking at the website as well, and there's a lot to dive into, and I like how you have made these categories, right? So that way you can really tackle immediate needs, and even if, for example, one issue spreads across all demographics. So I think that's I love it. I think that's wonderful.
Yeah,
Toss it over to Jeffrey.
We had something to say there, Cole?
Well, I was just going to say, like, you guys know that the individual veteran that maybe goes to a local Legion post or a VFW post or something like that, if they have a legislative idea, it tends to get filtered, at the local post level. It goes, state conventions and national conventions before it gets to American Legion or VFW headquarters. And they obviously have their presentations to Congress every year on their priorities. So there's a lot of different levels and layers there. So the model that we try to give veterans is more of a direct, hey, this is a policy under consideration. What do you think about it? And we can get that information back to members of Congress within days. So that's kind of, we tried to work around and give them more direct voice in policymaking.
Outstanding. So we're doing, this month we're doing suicide prevention awareness. So that's the topic we're going to laser focus in on. Suicide, as you probably know, affects U.S. veterans at a higher rate than the general population. How does Mission Control assist veterans in crisis?
Mission Control is a great name.
Mission Roll Call.
Yeah, no.
What is wrong with me today?
Calling me Kenneth Nash and Mission. It's fine. So I really, we're not a direct service organization, so we don't provide like crisis intervention. Like, we don't have paid counselors on staff to handle that stuff. We look more for the long game, right? We all know that suicide, there's no one thing that we can point to and say we need to fix this, and then veterans, will take their lives at a lower rate. So it's really about kind of improving the veteran experience in the United States through a lot of different things. And that's why we get involved in different pieces of policy that Congress and the VA is considering, because we want to improve quality of life, which will hopefully lead to a reduced rate of veteran suicide. It's pretty complicated. To answer your question more directly, we do have partnerships with other organizations where we refer them to caseworkers across the country that can get them the help they need. But it's not necessarily just mental health help, right? While suicide can, somebody can be more, what's the word I'm looking for? Having a mental health diagnosis can increase your risk of going down that path, but at their tipping point, it may just as much be acute financial stress, unemployment, relationship stress, any number of things that kind of puts them over the edge, right? So the key thing for us, right, is that the VA tends to look at suicide through the lens of mental health. And it's frankly a very reactionary approach, right? They say, if you're in crisis, call the veteran crisis line, which people totally should if they're in crisis. Or if you're having thoughts of suicide, we'll put you in inpatient care. We'll hook you up with a psychiatrist. We'll, give you some medications to try to reduce your symptoms, that sort of stuff. I don't really think that this situation is going to improve, the status quo is going to improve until we start trying to catch veterans more upstream, when not necessarily they're already having these symptoms, these mental health issues, but let's catch them with community organizations that are providing acute financial assistance or housing assistance or things like that. It's complicated, and it's not an easy thing to try to say, yeah, let's do that and let's provide these resources. But the VA is starting to head in that direction. We've already seen, the Parker Gordon Fox grants that provide grants to local community organizations that do this kind of upstream approach. And historically, the VA has gone from big VA medical centers to CBOCs and outpatient clinics to vet centers. And so they're over time getting closer and closer to community organizations. I think that's the right approach. I think we just need to move out on it and fund it more aggressively.
I do think you mentioned it already, the crisis line. So we can do a little plug for that. That's 988. And if you're a veteran, you can press 1. I mean, you don't have to remember that, I guess, if you don't want to. You're still going to get help with 988. And also, it seems like what you're describing is the same kind of evolution in biomedicine, that the hospitals respond to the symptoms of the moment. That's kind of how they were designed. So I can see how if someone's in a crisis where suicide is potentially going to happen, where their job is, we have to deal with this today, and somebody else has to deal with the long term after the fact. Like even regular hospital, they deal with you today, and then they send you to rehab to physically get rehabilitated, I guess is the word.
Yeah. And 50% of the roughly 18 million veterans in the United States don't even use VA. They're not even enrolled in VA healthcare. They don't have any interaction with the VA. So the approach of, hey, call the crisis line or, get mental health care help, right, it's just not going to work for 50% of the population. You have to get more creative. You have to figure out a way that you can reach those people. Some veterans may not use VA because they've heard horror stories from fellow veterans, and they already have this preconceived notion in their mind that it's, they don't want to use it for whatever reason. Some may have private health insurance. There can be a lot of different reasons, but the reality is, if you want to tackle this problem, you have to get more creative. And that's another reason why I think the community approach is beneficial, because you have organizations that have more touch points with veterans in their communities, that are more likely to engage with those veterans before the VA does. So that's just another benefit to that approach.
There you go. Ashley, you got something?
I was just thinking about all the community touch points from a local state, just to the vast number of, medical systems in each individual state, or even the VA in each of their visits, right? They're just these geographic locations, and how they each focus in on, respectively, within similar categories and groups to reach people. And I think you really summed it up nicely. I think we have a responsibility to continue to be creative in how we reach. And I really enjoy that mission roll call utilizes both polls and modern technology to really reach out and tap into that veteran voice. And I was looking at the website, and I know that you've got some questions under your poll archive regarding toxic exposure, and just kind of seeing some of those numbers just out there, right? I feel like when I'm having to look for stuff like that, I either have to dig into a website or have to dig into a VA document.
Yeah.
It kind of just gives me an idea of the realistic number of people based on your body, your community.
Yeah.
But I do really enjoy that it's just right there for people to see. I think one of them says like, do you plan on submitting a disability claim for your exposure to toxic substances while serving? And 71% of those that you polled said yes, right?
Yeah.
So I think for us as American Legion folks, we've got our veteran service officers that are out there that are, the boots on ground that can assist with something like this, and being creative and having multiple touch points in our community and looking at our posts, and even our like Legion departments would be a potential, assist or solution to, resources otherwise not tapped into by big VA. So I'm
Absolutely.
just kind of summarizing, but I'm taking it all in. I'm like a sponge today, so you just have to forgive me.
Yeah, and for anybody that wants to opt in, right, that isn't already, you can go to missionrollcall.org, and there's plenty of different ways that you can sign up. We don't actually ask for any money. It takes 30 seconds to sign up. We'll ask you, if you're a veteran, if so, which branch you served in, which era of service, that sort of stuff, so that we can sometimes tailor like if the Marine Corps was coming out with a suicide prevention policy or whatever, right? We can only poll Marines or something like that. So it's really quick. It's really easy. We have a large social media presence on all different social media channels. But yeah, the polls are a huge thing that we do because, especially with the younger generation of veterans, you see that they want to be more engaged in not only advocacy, but in their community, right? Which is why they're getting engaged with organizations that kind of do things in a more non-traditional type of way. So to your point, connection at the local level is key. A lot of people, when they transition, they lose their chain of command, they lose that support peer network fairly quickly. And it takes them a while to reinvigorate those peer networks. But local Legion posts and other organizations that are on the ground, it's just, the personal connection and the peer support group is super key.
I could not agree more. And I'm thinking along the lines of, what are some unique challenges? We've talked a little bit about suicide prevention, but what are some unique challenges for tribal and rural veterans, and how does Mission Roll Call help those particular folks?
Yeah, so some of the unique issues is for both groups, rural veterans and tribal veterans. There's some jurisdictional issues on tribal lands. Access to healthcare is particularly difficult for them because they have to drive long distances to get to any sort of VA medical center or outpatient clinic or things like that. Expanding broadband access, which Congress has tackled in the last few years, has been a big thing for them, because as with the expansion of telehealth and video conferencing kind of appointments rapidly expanded during COVID, that was a unique access issue for them. And then, with, for instance, like tribal, right, there is, this is getting really specific, but for female veterans that are on tribal reservations, there are unique challenges that they have that relate to being a member of a particular tribe, right? It's no secret that on tribal reservations, sexual assault or sexual harassment, for women is a issue that affects them at a larger percentage than a lot of other demographic populations. So that may play into how the VA provides them care. It may be an issue. So we have gone out to different reservations in Arizona. We talked to veterans. We're going to Montana next month. We've been to other kind of rural areas, populations in Florida, talking about the unique issues that they have. I would say it's mainly access to care, right? And just because there are less veterans in those geographic areas, they are at higher risk of kind of isolation and not having those peer support groups. So giving them the ability to connect in other ways with groups online, right? And maybe that's how they have their peer support group. But making sure that members of Congress are continuously aware of those unique challenges that they have. And like I said, when we go out to these places, we do poll those communities about their satisfaction with their VAs, but we also tell their stories. We've done a couple of videos on the reservation last year. We haven't been this year, or veterans in rural areas, and we take that and we give it to members of Congress just so, you know, it humanizes the issues for them versus just having the data.
Outstanding. So there are different challenges for different geographical areas, different demographic areas, and that kind of leads to your call for more community-based, smaller things. My only issue with the community model so far is it's so segmenting. And depending on where you live, you might be close to one that services you, but you might not. There's women veterans who are nearsighted and left-handed, go here. Combat veterans who saw some combat but didn't actually get shot at, go here. Like the vet center, you have to be a combat vet. So if I have someone going through crisis at my post, before I can refer them to them, I have to start investigating if they're eligible or not, because some people prefer that because it's more anonymous. But they have to be a combat vet, and I can't send them there. Then that puts me in a weird position of having to investigate their service. So the community model has some advantages, but I still think we have some work to do. The whole veteran is a veteran kind of thing, so that more people can take advantage of these smaller experiences versus the massive VA experience. I don't mind the massive VA experience because I got a lot of stuff wrong with me. I don't know if you know, I got a lot of baggage, and so I can go there and get like three things in one day, you know.
Yeah. No, I agree. I think there are advantages and disadvantages to both. Obviously, the VA does things, certain things for veterans better than community providers will, just because they understand, you know, the veteran community better because that's their job, right? So, and I guess it depends, right? Because there are something like 46,000 VSOs registered in the United States. And frankly, I would say less than half of those probably do, you know, good, meaningful work around the country. But yeah, it can be a challenge. It's like paralysis by analysis or analysis by paralysis. I forget what it is, but you Google things for veterans and you have to go through this list of potential programs or resources that could benefit you. And I think that's why the one size fits all approach is, you know, it just doesn't work in different areas of the country, right? VA may have the ability to reach a lot of veterans in Dallas, Fort Worth, or LA. That campus out there is beautiful. You know, or New York or Washington, DC, right? But if a veteran in Montana, it has to drive 3 or 4 hours to get to the local VA or Kansas or wherever. There may be some community organizations that are closer to them that could fill whatever need that they have in a more timely basis. I will say that generally speaking, I've had good positive experiences with the VA in DC. But, you know, I still have challenges sometimes, and it's the VA in our nation's capital, right? I submitted for an appointment, a mental health specialty appointment back in late April, early May. And they said the earliest that they could get me in was September. And when I kind of complained about it, they were like, oh yeah, we can, hold on, we'll change it. And it was only 2 weeks earlier. And then a week before the appointment time, I got a letter in the mail saying that they canceled my appointment, and they didn't, you know, they tried to reschedule. And I was like, at this point, you know, it's just, can I just use community care, right? Can I go out into the community? So every veteran's, you know,
Was that approved, by the way?
What's that?
Was that approved?
Yeah, no, it was. It was.
But it's weird that you'd have to ask for it.
Yeah, and that's the other. There were reports in the USA Today late last year about how some VAs were not following the law of the Mission Act, which is you have to refer for certain six different things: time and distance, obviously, best medical interest of the veteran, things like that. But they're not doing a great job. And frankly, that's a consequence of the VA being the largest healthcare provider in the country. And it is complicated to implement a law that big uniformly well. So you're going to have areas that do a better job than others. But the data, right, is pretty clear. VA just testified a month ago that community care now accounts for 1/3 of all their healthcare budget. And more veterans have been authorized every single year than the previous year. So veterans are kind of voting with their feet and saying, either the VA can't give me what I need in the time I need it, or the VA care I'm getting is not as good as what I think I could get in the community. And they're going out and using the community. So the VA came out. This is one of the poll questions we did, actually. The VA came out and said, the program has been so successful that we are going to change the access standards, which would effectively make it harder for veterans to use care in the community at a time when they're using it at a higher rate than they ever have before. And I think that will probably lead to higher wait times and potentially even to veteran harm. So we polled our membership and just said, hey, and put it in context and said, do you think that Congress should make these access standards permanent before the VA can change them? Or should we just let the VA change them? And overwhelmingly, people said Congress should make the current standards permanent. So that was something that we got involved in recently. And I think it's going to remain a topic of discussion going into next year.
I saw you unmute, Ashley. Are you chomping at the bit?
Both of my animals are communicating.
They
want to join the conversation, Cole.
Yeah, Kaya's laying on the floor right behind me. So
I have one at my feet, the other at the stairwell, staring at me.
So Cole, your pets are well behaved.
Well, Kaya's a service dog, so that's actually why I got involved in veteran advocacy in the first place. Back in 2014, I had a suicide attempt, and a Marine, intervened. But I got involved because the pills and the therapy weren't helping me, so I stopped taking medication that the VA had prescribed, and found out through a friend that service dogs were an option, but the VA didn't fund them. So I went out and paid roughly 10 grand of my own money to get Kaya trained. And I was up in DC interning, and Senator Tillis stopped me on the street and was like, hey, what's up with the dog? And I started telling him. And he said, well, what do you think we should do about it? And I said, well, you're the policymaker. You tell me, right? Like, I don't know how this works. And so we had a meeting, and that was actually when Secretary Wilkie was still working for Senator Tillis as his national security advisor. So I met with them, and they said, these are kind of some options that you could pursue. So I drafted a white paper and a potential bill with language and shopped it around, and then it ended up getting introduced. It was called the PAWS Act, the Puppies Assisting Wounded Service Members Act. Ended up getting introduced, didn't pass that year, but ultimately President Biden signed it last August. So makes service dogs more widely available for veterans with these issues. So
that's fantastic.
Yeah,
that's wonderful.
Okay, come here.
Yep.
This
is like our old bingo card that we
yay. Oh, hi, Puff.
All right. Off. Thank you. Yeah, sorry.
Even with no vest, just
yeah. No, I mean,
point.
She typically doesn't, like, unless I'm obviously out and public access is a thing. She's just a normal dog around the house.
Yeah. Well, that's a whole other topic on for mental health and suicide prevention awareness. The use and benefits of service animals. Unfortunately, we don't have time to do that today. So right now, outside of Kenneth Nash Post 8, what can Legion members and others do to learn more about mission roll call, not control?
Yeah, I think I already mentioned, just go to missionrollcall.org, sign up for those text and email polls. We send them out pretty regularly. It doesn't cost you anything. It takes you, less than a minute to sign up, and it's really valuable because the more veterans we have on those lists, the more powerful it is when we can take the results to Capitol Hill and people pay attention to it. And so do that. If they want to engage with us on social media, watch our content, YouTube, or social media channels, if they want to donate, they can donate. But yeah, I think that's the best way to get involved with us.
All right. So any last words, Ashley?
I just want to say thank you for putting this, giant engine together. I think that there is a lot of power in our, voices, right? Just as the American Legion touts numbers, I think this is just as, and if not more important, considering what you're trying to do as far as polling, because us as American Legion members, like, we also need that, right? Like, we are actively trying to step into a direction that meets the needs of the next generation of veterans, and you are doing that, Cole. So I just want to say thank you for your efforts and everything that you're doing for the community. And hopefully I can see you around the DMV area, because I know that things are opening up. I'm trying to go do stuff. It'd be nice to see people who live by me.
No, it's great. I appreciate you guys having me on, and hopefully, see you soon. Next time I get out to LA or Indy, I'll let you guys know. I gotta see that easy post.
Yeah, you gotta come on down anytime. I know people there, so I can get you in. No password required. So again, excellent work. You probably don't even know how many lives that your work saves, but we have this program going called Be the One, and if every one of your contacts in your database can effectively help one other person, then I think that your impact is going to be immeasurable. Even if we could measure it, we can measure it in real numbers, but we can't measure the impact and the benefits to, as we like to say, community, state, and nation. So thank you so much for being on our show, bringing this light of information. All of your information will be put in the show notes by super producer Holly, who I'm sure you've met through many, many emails. And right before the show, I was there when you met her there. So I know that happened. And thank you so much. For everybody else, we're going to talk about Cole again, but he won't be here. And we're going to do that right after the break.
Family and community engagement. The American Legion meets the unique needs of local communities. We are veterans strengthening America. We are the American Legion.
And we are back. We changed into our original garb, and we're here to talk about our guest. Ashley, do you have any takeaways?
Yeah, so I really enjoy everything that Cole is doing. I think that in order for us to make informed decisions, we have to have data. I've commonly said this in many facets of my life, but if an opinion is an opinion, but an opinion backed by data is a solution, right? And I find that when we have the data, when we know what our veterans are being pulled across the country, we, as even the American Legion, right, in mission roll call, can make informed decisions and help guide policies that improve the lives of military families for generations to come. So I appreciate everything that Cole has done and will continue to do for our community. And I want to thank him for, putting the pedal to the metal. Numbers are not everybody's thing. So
well, I appreciate data as well. Although I know that data can be manipulated to make any kind of point that you want. But so data paired with an opinion makes a compelling argument. If you just throw numbers at people, don't care. But you do, if you have a story and a real personal narrative element added to the numbers, that's how you make a great compelling argument. I've tried it on dates, though it doesn't work. I just say, I try to give data, then I give a story about how amazing I am and that they can ask my mom and she'll, she will corroborate my story, and they don't seem to care about that. It's weird. All
Is
right.
your mom your emergency call? Like if a date's going bad? Oh, sorry, my mom's calling me. I gotta go.
Well, I don't say, oh, I've been out of the Midwest for a long time.
Okay. All right, Ellie bestie. I got you.
Are you ready? Get the guns
Yes.
blazing. Wait. All right. It is time. I don't know what Holly's saying. She's annoyed though. Oh, yeah, you don't. There's nothing. There's no smoke to clear. All right. We are ready for today's episode. Oh, nope. Today's version of Pew 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 Rapid Fire. All right. I'm probably the biggest fan of Legion Town in the American Legion. And today I found a great story that I pulled from Legion Town. This is I only did 2 rapid fires because this is a little bit longer than most of our rapid fires. All right. During the pandemic, Laura, a member of the Wesley Wyman American Legion Auxiliary Unit 16 in Goffstown, New Hampshire. Thank you, by the way, Laura, for giving all of that information. That is one reason why I pick stories. I need to know who wrote it, where they come from, who you're talking about. Anyway, much of the reason for her interest in pursuing this role was the company's support of veterans. She was offered a position as the Director of External Partnerships at Mobius Mobility. Mobius Mobility in Manchester, New Hampshire, are the proud inventors of the IBot personal mobile device. The IBot is a power wheelchair with abilities beyond most people's beliefs. I'm getting excited. It trudges through sand, snow, conquers curves, trail exploring, climbs stairs, and most importantly, brings the user to eye level with those around them. Mobius hired Laura to help orchestrate a tour across the USA to gift these devices to 25 VA spinal cord injury centers and 25 additional veterans. The company truly is giving freedom to those vets who need it. I'm going to skip down to currently any veteran who receives their care at the VA and is prescribed one of these devices is eligible to receive it at no cost to them through the federal supply schedule. I know this tour really happened because they came to Hollywood Post 43 here in lovely Los Angeles, California. And they demonstrated this IBot thing. It's freaking awesome. It can climb stairs. A wheelchair climbs stairs.
I love science. I love technology. I'm kind of a STEM nerd myself, and I appreciate this tremendously. I think it's amazing. I think it's definitely revolutionary in medical technology, and it's helping injured veterans lead full lives.
I mean, I don't know if you heard me. It climbs stairs.
I know, it's very sci-fi like. I've been reading a lot of Philip K. Dick, so I'm just lately everything is just microchips and like.
I don't know what you just said, but I'm going to remind you this is a PG rated program.
No, he's a sci-fi. He's literally probably, I would arguably say the father of sci-fi, maybe one of them. People can argue with me all day, but I've been reading a lot of him.
Argue with you.
I know.
He probably would. He probably would. All right, so IBot, look for it, and look for them on tour, and look for them if you have the medical history that you would benefit from this. I really think this is true mobility. I mean, you don't have to wait for the elevator when you go to a building. You right up them stairs. That's amazing. All right, are we ready?
Mm-hmm.
We are rapid fire number 2. All right. New York State Commander promotes drive-by membership for those of us. This is from the American Legion website itself. What?
Ooh.
What? Are we dog fooding our news now? So in 2022-23, American Legion Department of New York Commander Dave Riley had his personal vehicle wrapped with the Legion emblem, brand mark, and 6 branches of service to include Space Force. Riley added an additional feature, a membership QR code. The membership QR code is on the back of the vehicle. When someone scans it, they are taken to the Department of New York's Join page. All the younger veterans, everything is by their phones, Riley said. They're going to scan it just to see what it is. It's the curiosity. Now they can scan the back of my car and join. No verbiage such as join now appears on the QR code. Riley did that for a reason. When veterans see the American Legion vehicle QR code, I wanted them to be curious and scan it. I wanted the curiosity of the code to get them to scan it and see what it was. They're going to scan it just to see what it is. They scan everything for information. I'm wearing a Department of New York hat right now, and I'm just feeling this. And I feel QR codes in California's membership future with nothing on it. I can just see like all veterans scan here, like no mention of, like he said, don't put join now. I just want them to click it and see what it is. He went through great lengths to say that they're going to scan it. Just see what it is. The treasure hunt. Would you scan it?
Mm-hmm.
She's
Yeah,
nodding, ladies.
I would.
Okay.
I would. Yeah.
I'm thinking about actually, matter of fact, I'm thinking about doing this for my post too. I think people should just drive around with a QR code on their the back of their, no words, just see how many people scan it.
You know what? I've seen some weird things. I've seen some interesting stickers. I actually took a picture of a vehicle more recently, and it had student driver stickers all on the side. Like, I feel like this is a teenager who got in trouble and their parents were like, I'm just going to embarrass you, and put stickers on each side of the vehicle. And like, it was hilarious. It was definitely a young kid driving, but it was like a nicer car. So it was like that way of, it was like for our military folks, it was like putting a PT belt on a vehicle. And it was a nice car. It was a nice car, but it was just these yellow student driver stickers on every side.
Well,
I was cracking up.
People do the QR code, they won't think it's a punishment though.
True.
I hope they think it's doing great. Holly had something popped up. Holly was saying you could put them on decals or even magnets. I was actually thinking of magnet because I'm not sticking anything permanent on something that's painted. Come on now. So I'm thinking everywhere we go. As a matter of fact, super producer Holly, wherever we go next, can we just have a t-shirt that's just a QR code, nothing else? Well, no, maybe just a Tango Alpha Lima, and they won't know why.
QR code.
Yeah, they won't know what they're gonna get.
Can we put your face and the QR code around it? Can we do that? Like one of Ashley and Jeff? That would be really cool. I would have a lot of fun with that.
I wear each other's.
Either or. I don't know. We could figure it out. We could put Team Jeff and Team Ashley, and we could be at convention next year, and we could see how many people like tally in for us. That would be fun.
Like a
You'd
vote?
have to find us. Like a vote. Yeah. We could, I don't know, do some fun prizes. I don't know. Let's look at creative. We got time.
All right. The QR codes.
Convention, here we come.
The QR codes are.
Go on.
No, I'm just gonna, because you do this pause, and then I think it's okay to talk, and then
you should know better.
No, yield to oncoming traffic is all I'm gonna say. So thanks to Department of New York Commander Dave Riley for this great idea. I'm probably not going to wrap my whole video. I'm not going to wrap my whole vehicle, but I am looking at this QR code on a magnet thing. I think it could be done. And you may see Tango Alpha Lima and a QR code t-shirt. That would be fun. All right.
Ooh, I have something.
More thing?
I have one. Okay. So I know that you only put 2 rapid fires in, but I have a really quick rapid fire that I think is worth mentioning. Spontaneity.
So is this your shout out?
This is a shout out for Virginia Post 139, who has basically, so let me digress. A new home for American Legion Post 139 in Arlington, Virginia also means new housing opportunities for veterans in the community. So Post 139 is now located on the first floor of a 7-story Lucille and Bruce Ty Wilger place, which also includes 162 to 3-bedroom rental units, meeting rooms, and counseling office, as well as an outdoor recreation space. The grand opening for the building, which already houses some residents, took place on September 23rd. Guest speakers at the grand opening included the VA secretary, and 50% of the building is veteran housing, said Post 139 Commander Bob Romero. So in addition, a good friend of mine, Robert Davis, who's also my personal trainer, is a tenant and resident at this facility and got to speak and was selected to speak. He used to work at Hill Vets and he's done a lot of stuff on Capitol Hill, and he gave a very emotionally charged speech about how important this housing was. And I wanted to just give a shout out to Post 139, who has innovatively looked at the Arlington Partnership for Affordable Housing and bought the 1.4 acre property in 2016 for about $9 million. Like, there's this whole crazy partnership going on, and it just speaks volumes about what the American Legion can do to partner with our community and also provide critical services and need-based housing and other assorted items for our veterans. So I just wanted to shout that out. I know that there's an article on our website specifically talking about a new home for VA Post 139, a new home for at-risk veterans. So, and that's as of September 27th. So I encourage folks to go check it out and get in touch with that post for a really nice, blueprint of how to do that in your community.
Well, I was going to ask you for final thoughts and shout outs, but
there it is. There it is, ladies and gentlemen.
You already did it because you thought I'd forget you.
Of course.
How can I forget you, bud? All right.
I don't know, bud. All the buds. Whoop.
All right. So right now I would normally say what?
I'm just doing it on purpose now. I can't help myself. Okay.
Ladies and gentlemen, if you like the interrupting, please let us know at tangoalphalima@legion.org. Anyway, so I was going to say final thoughts and shout outs. Oh, done. All right. Done. We're done with that. Can you take us out?
Of course. So do not forget to subscribe to the Tango Alpha Lima podcast on YouTube, Apple Podcasts, Spotify, or wherever you are consuming your podcasts. Please leave us a review and give us a big old 5-star rating so the world knows how much you adore us. Yay. And if you really want to see Jeff and I with QR codes and tally marks, we're totally down for that. I just need it in writing. Thank you. But be sure to tell everyone you know about the Tango Alpha Lima podcast. Don't be a lone alpha on the block. Alphas, you're better as a pack. Ain't that the fact? Look, what? See, look at that. I'm rhyming. I got a lot of energy today. I'm feeling good. Alphas, where you at? Like, let's go. Okay, I'm done. As Jeff stares at me blankly. Holly, super producer Holly is cracking up. I am on one today.
I'm just in a bit of shock right now. But alphas, you know that you are not part of the pack, you lead the pack. So go ahead and spread the word out there, get people around, do the thing, and
all the things.
I would never say that unless Holly writes it and I accidentally read it, like she did one time. She pranked me and wrote all the things in the copy, and I just read it. It was a dark day. It was a dark day. But alphas, you are out there. You brighten my day. You brighten my week. You brighten my month. You brighten my year. And you brighten this project that we are doing here. And with that, I'm going to declare season 3, episode 128 mission complete.